Hello and welcome to Lady Talk series, season 1, episode 2. I am Katie Flaherty, CEO and founder of Shine with Courage, where we promote healing from trauma, empowering others to reclaim their life, and promoting joy. Today I have the pleasure of interviewing Marina Castellanos.
Yeah, you got it.
Welcome. Thank you so much for being with me. Do you want to just introduce yourself and your practice?
Sure. Thank you so much for inviting me to be here today. I'm really excited. So, I am a physical therapist in Westchester County, New York, and I specialize in helping women, children, and teenagers who have pelvic floor dysfunction. So, meaning, they have issues like constipation, pain with intercourse, any other kind of pelvic pain, urinary incontinence, fecal incontinence, bedwetting, different issues like that, issues during pregnancy like pain, and postpartum healing as well.
Yeah, I was just fascinated by the fact that you do pediatric pelvic floor therapy. I didn't even know
I
that was a
do.
thing.
I do. I mean, children have pelvic floors too. So bedwetting and constipation, they're all really common pediatric pelvic floor findings. And having the ability to help them is really great. It really makes a huge impact on their families because it's a pretty decent percentage of children who wet the bed and have these issues that are just kind of told by medical personnel maybe that it's normal and they'll grow out of it, and often that's not the case and they need to get some extra help.
Is one of the signs of that just the bedwetting, or are there other signs?
Yeah, so I mean, really, issues can start even as an infant. Babies have constipation a lot, and it often you need to take into account their developmental history too. So if a baby is a little bit on the weaker side and maybe has some lower overall muscle tone, their digestive system might be a little sluggish. They have a tendency to get backed up with constipation, and that can kind of pave the way for pelvic floor issues down the road and can result in bedwetting and eventually fecal soiling and pain. And these things can definitely persist into adolescence and even adulthood.
Wow.
Yeah.
So do you want to tell us briefly why you became a pelvic floor physical therapist?
Sure. So I've been a PT for about 20 years, which is so hard to believe. I feel like the time has just flown by. And I started out working in developmental pediatrics and thought I was going to do that my entire life. That was my course that I was on. And then, years back, that changed because I developed my own pelvic floor dysfunction. I suffered with pelvic pain. And in going through the process of dealing with that pain, being seen by different providers, and going through the rehab process, I just felt so driven to learn more, because this isn't really education that you get in physical therapy school. I mean, we touch on it, but it's really a specialty. So all the people who do this, take it upon themselves to go for months and years of continued training. So I started doing training, and I just kind of fell in love with the specialty. And I said, I really need to do this. I want to work and help people who have these issues, people like myself. And there's a real great need for it, because the specialty just isn't that well known yet. We're trying to get it, more well known within the medical community and the general public. But, if you go in your community, most likely there aren't many pelvic floor physical therapists in the area. So really that just put me on a different course, and I decided to open up my own practice. And I've been doing that now for about 5 years.
Awesome.
Mm-hmm.
Yeah, it took me a little bit to find a pelvic physical therapist in my area. So,
Yeah.
and I think it's very important to overall healing as a woman. So I definitely found it beneficial
Mm-hmm.
and imperative that you have the pelvic floor physical therapy done for
Absolutely.
any sexual dysfunction disorders. That was probably 75% of why I'm treated now, besides the other treatments I've received. But I think
Right.
it's very
Pelvic
important.
PT can really be a crucial part of a team approach. So for people who have other, medical specialists, physiatrists, psychiatrists, physical therapists just work, with the rest of the team to help the individual person.
Yeah.
Yeah.
And can you explain more, what does a pelvic floor physical therapist do exactly?
Sure. So a little just background about what the pelvic floor is, in case anybody doesn't know. So the pelvic floor refers to this hammock of muscles that we have at the bottom of our pelvis, and it runs from the pubic bone in the front around back to the tailbone and sacrum, and it attaches to the side walls of our pelvis. So if you imagine this little bowl that you have at the bottom of your pelvis, there's different layers of muscle that are responsible for our continence, so we don't leak urine, gas, or feces. It plays a role in our sexual functioning and pleasure. It acts as part of our core support system, along with our abdominals and our back muscles and our respiratory diaphragm. And it also helps to support our internal organs. So for women, that includes the rectum, the uterus, and the bladder. So when something goes, when there's some kind of dysfunction that arises in the area, whether it's leakage, pain, constipation, issues during pregnancy or after pregnancy, pelvic floor physical therapist can evaluate that person to see, is there something going on with the muscles? Is there something going on with this person's alignment? Is there something going on with their strength? Are their muscles flexible like as they should be? Because really the pelvic floor is a group of muscles just like you have anywhere else in the body. Mm-hmm. So muscles need to be able to contract, relax, and be coordinated with other areas of the body. So a physical therapist who works in this specialty is an expert at just honing in on what are the factors that are causing this person's symptoms, and they can do a whole body assessment to really see what's contributing and not just look at the pelvic floor, because we want to look at everybody as an individual whole person. So nothing in our body works in isolation. So a physical therapist is really an expert at looking at the whole musculoskeletal system from head to toe, which is really important in evaluating for these disorders.
Okay. Do you think do you perform biofeedback as well? Because my physical therapist did that. I only had like one session, but I'm wondering how crucial that is too.
I do. It depends on the person. I tend to use that more with children than I do with adults. So with adults, it's a lot of retraining the musculature in the area that needs it. So a lot of times I find it's better just with manual feedback. So when I do an examination for somebody, which involves doing an internal, it's not like going to the gynecologist where you're sitting with stirrups and they use a speculum and they're using all their instrumentation. So everything that I do is super gentle. It's just done manually with a finger and always done within a person's realm of comfort. So, but if I can do an internal on a person, I can find, somebody can give me the feedback of where exactly it hurts and where there's some weakness. Because really there's so many different layers to the muscles that are all interconnected. So I want to make sure that there's symmetry going on with, different sides of the pelvic floor, front to back, right to left. So biofeedback is great for children because we use it on the outside of the body. For women, we can do it on the outside or the inside. I tend to always go with an internal manual exam first, just because then I can tell where the discrepancies lie within the muscles. But biofeedback is great just because it's another tool that we use to just help a person to retrain those muscles and to kind of regain the connection with the muscles and the brain, because sometimes when there's been a lack of activation or pain for so long, we can really use the biofeedback and other types of therapy just to help either calm the pain down or help to get the muscles stronger when needed.
Okay. And how would someone choose the right physical therapist?
So you always want to ask about somebody's background. Like I said before, physical therapists go for a lot of training to do this. Go for, weekend courses, week-long courses over the course of months and years to just keep progressing their expertise. So you want to just ask the background, what kind of professional are they? Are they a physical therapist? Because then if they are, they already have a certain degree of medical expertise. Mm-hmm. And then ask them, what courses have they taken? Maybe they haven't taken a course in pelvic pain, and that's what your main concern is. Maybe you're concerned about urinary leakage, but you have some pain as well. So you want to make sure that the person is able to, address both those things at the same time and not just tell you to do, 100 kegels a day. So just keep asking for more information about the person's background.
Okay. So would you say that all physical therapists are trained in the pelvic area, or do they have to choose that segment to be certified?
They have to choose it. So, and really it's just going to these renowned companies and continuing their education constantly. So that's why it's important to know, what education and background the therapist has that you're speaking to.
Okay.
Mm-hmm.
And you explain what the pelvic floor is. What are some changes someone can implement immediately to improve their pelvic health?
So that's such a great question, because there are really easy things that people can start doing right away to help their pelvic floor. So one is ensuring that you get enough hydration. If somebody's experiencing some leakage, they might have a tendency to shy away from drinking enough water, especially if they're going to go out for a walk or do exercise or something like that. But you always want to make sure you have enough hydration. You really need that for the overall health of your pelvic floor and for your bladder. So if you go to urinate in the bathroom, what you want to see is a pale yellow color for the urine. So there isn't really a magic number for how much water you should drink a day. A lot of people will say half your body weight in ounces, but I've never really found a study to back that up. So what I tell people is, you drink enough so that when you go to the bathroom, you just see a pale yellow color. Another thing is for when you have a bowel movement, you want to use a footstool underneath your feet. So what that does is it helps to elongate certain muscles in your pelvic floor that go around the rectum to, give them some slack and help them relax. That allows for an easier bowel movement. So it's especially important for, people who tend to be, constipated and feel like they have to strain. But really everybody should be using it. You can get any footstool, or squatty potty is a really popular item amongst the pelvic floor physical therapists. I just want to make sure that you get your knees a little bit higher than your hips and you're just resting your arms comfortably on your thighs.
Interesting that you said pale yellow urine.
Mm-hmm.
What do you feel about the myth that you are completely hydrated if your urine is completely clear? Because I hear that a lot.
That's something that I've never really, seen any kind of scientific backing for. If you're thirsty, obviously you should drink. If you're exercising and working out, you're going to need to drink more. But what we want to avoid is having so little hydration in the body that the urine gets more acidic and will trigger, excessive spasming going on in the bladder. So if somebody already has some leakage, say after having a baby, that would make it worse. So we just want to make sure that there's enough, hydration so that the urine doesn't become super acidic. And then if there are complaints, about somebody who maybe has some pain with intercourse, you want to work on some belly breathing. What that does is it just helps to relax the nervous system. Our bodies are really wonderful at remembering things that cause us pain, and it can go into protective mode. So really you only have to have something be painful once and your body will remember it. So if you have a painful bowel movement, a painful urination, a painful episode of intercourse, the next time you go to do those things, your body might just spasm up a little bit, and you'll have a harder time with that. So a lot of what I do with people is work to retrain the nervous system. So we have to get the body out of this, active protection and guarding that it's doing.
And can you elaborate more on women who deliver and either C-section or natural delivery? I feel there's a lot of women out there that feel they're alone with symptoms that they receive after having a baby. So do you see a lot of women that just had a baby for physical therapy?
Yeah. And, personally, I get it too, because I have an 8-month-old and I wasn't expecting to have a C-section and I did. And it's a really vulnerable time, right afterwards, especially because, you're tired and exhausted and you're caring for this newborn and it's a total change of life. So, um, for women who have symptoms after childbirth, they need to let some healing and rest occur as best as they can. Try to call in some support. Right now, we're in the middle of a pandemic, so that means it's extra challenging for families to get support from the outside because we're all supposed to be social distancing. So planning ahead for certain things like, for meals to stick in the freezer, make sure you always have, food readily available for yourself can be helpful. But, women tend not to talk about these things that happen after birth, like urinary leakage and, pain with sex and, how they feel about their new bodies postpartum. But I feel like all women, go through this. We're just not used to speaking about it. So, women should, definitely seek out support from other moms, other new moms, seek out support from a pelvic floor physical therapist who helps moms because they can answer a lot of questions and provide a lot of education and knowledge, and also help to work on resolving those symptoms that persist after the initial couple of months after having a baby.
Mm-hmm. Thank you. And one of my kitties just rubbed my foot, so I lost my train of thought. I was going to ask you a question about what do you feel the percentage of women that you see have a lot of pain from intercourse? They don't realize maybe there's something else going on. For example, I was diagnosed with vaginismus and I did not realize I had it. And that's one of the reasons I receive physical therapy. So what do you think if the percentage is of women you see?
I would say, right now, probably, half the women I see have some kind of pelvic pain. It's not necessarily vaginismus, because there's other forms of pain with intercourse. There's vestibulodynia, vulvodynia, and there's women who have pain with, initial penetration for intercourse that don't have vaginismus. So it really depends on the person, but, I'll say that everybody kind of presents differently. And sometimes the woman doesn't realize it. Sometimes it's her male partner or a female partner or somebody saying that, they feel like they're hitting a wall when there goes to be some kind of penetration, and they don't understand why it's happening. So then they, start the voyage of trying to get answers and figure out what's going on. And that can be a long haul and it can be very stressful, which doesn't really serve pelvic pain in any way. As women, I think we tend to focus a lot of our pain right in our pelvis, our neck and our pelvis. So those kind of two areas I always tend to pay extra special attention to when somebody's in pain. But yeah, I would say right now, I do have a good amount of women who, suffer from, pelvic pain, and some of them have been dealing with it for a long time and just kept putting it on the back burner. And then finally they said, okay, enough is enough. I'm going to get help for this. And then other women, they're more proactive. They seek out help a little sooner, maybe after, a few weeks even, or like a month, and they want to know what's going on.
And would you say that painful intercourse is normal or not?
No, intercourse should never be painful. If you have experienced any kind of pain with intercourse, there's definitely help. And really, there should never be pain with intercourse, pain with urination, pain with bowel movements, but especially with intercourse, if there's pain with penetration, pain with orgasm, pain in certain positions, all those things can be very worrisome, and you should definitely seek out, professional guidance.
And one of the things that I think is important with physical therapy from my own experience is dilating. So do you want to go more in depth with dilation and how crucial it is, or what your thoughts are?
Sure. So for the right person, a dilator can be really helpful. So a dilator involves putting something, so I don't have one right with me, but I will show you for the people who actually can see the video. So a dilator can involve something even this small, and they're usually made out of silicone and they're very soft. So a therapist might teach you how to insert something, either most likely very shallow, into the vagina, just to help open that opening where something would penetrate, either, a speculum or, a partner. And the point of using a dilator is to kind of stretch the muscles gently and to help relax the muscles. So we start off with something, maybe very small, like a width like this, and then progress to something, wider and wider. So the point is to have that opening eventually get bigger and bigger to allow for easier exams, to use a tampon, to allow for pain-free intercourse. But, also one of the things that I tend to prescribe along with that, for the right people, is to just do self-exploration before using something, before putting an object inside, because it's a different feel. When you do something with your hands, you're getting a lot of feedback into your brain rather than using an object.
Right, thank you. And what message did you hope to share during our session to the audience?
Really just knowing that, urinary leakage, pelvic pain with intercourse, any kind of pelvic floor issue you might be having, might be common, especially if you're a new mom or a seasoned mom, and you can have these issues if you've never had children as well. These things happen. It's common, but it's not normal. So there's so much help available. You just seek out, your local pelvic floor physical therapist. Most of us work through telehealth right now, especially during the pandemic. So I'm in Westchester County, New York, but I can work with anybody in New York State. So people who are, hours away, travel-wise, we have the luxury of just working online together, and there's so much, value and education that I bring to them, even though they're not in person with me. But it's so important to just seek out guidance from an expert to, improve your symptoms, and you want to get back to, your normal life.
And are there any exercises that can help them during this pandemic where they can't see anyone?
Right. So I would say the best exercise for everybody to practice is just some belly breathing. So just kind of sitting with your shoulders relaxed, putting your hands on your belly, and just taking some deep breaths and having your hands move forward and back. So what that does is it helps the pelvic floor to relax. It helps your inspiration. So when we work on belly breathing, we help to restore some normal coordination to the pelvic floor. So even if you have weakness, even if you have tightness, it doesn't really matter. This is still going to be, helpful for just your overall well-being for the pelvic floor. Other exercises have to be guided more on a one-on-one basis. I can't tell everybody start doing your Kegels when I don't know what's going on, with an individual's pelvic floor. So they might have some urinary leakage, but they might have some tenderness in other areas. So it really depends on the individual situation. A lot of what we're told is just to keep doing Kegels, all day long, and everywhere you are, throw in 10 Kegels. But it's not really, it's not such an easy broad recommendation to make.
Is there any dangerous effects to that if you shouldn't be doing Kegels?
Really, if somebody is experiencing pain, they might have some tightness in the area. So then I would say hold off on doing Kegels until you speak to a pelvic floor physical therapist, because if you have a muscle that is already tight and then you go to contract it, you're just going to be possibly causing more pain in the beginning. So we want to make sure we restore some movement in the muscle, some flexibility, and then work on, the strengthening side of things.
And have you seen any patients for telehealth outside of New York State?
So in New York, every state is different in terms of their laws and regulations. Okay. So in New York State, I can see anybody for telehealth, for physical therapy. For people out of state who want to work with me, I can work with them on a wellness basis. So I can't provide individual guidance in terms of, okay, this is what we're going to do targeting your specific pelvic floor because you have this problem. So I can give them overall guidance on overall health and well-being for their pelvic floor, but I can't address a specific concern like that. And that's just because of my limitations from being in New York.
For your license?
Yeah.
Okay.
Yeah.
And there any other questions that you would wanted me to ask, but I haven't asked yet to share?
I don't think so. I think we covered a lot of good, basic info, and it can be overwhelming to hear all this stuff. But there's so much information online now and on Instagram. There's a lot of sources that people can follow. I'm on Instagram too. I try to put out relevant content. But really, just the point that I want people to know, especially women, and men can obviously be affected by pelvic pain and pelvic floor issues as well too. We shouldn't leave the men out. There is help, and you just have to, take the steps to get some.
And how can people reach you?
So my Instagram handle is Marina C Pelvic PT, and my website is www.marinacpt.com. And my direct email is marina@marinacpt.com. And I'm always happy to answer questions.
Okay, well, thank you so much for your time. I really appreciate you, and you're very important to society, so keep doing what you're doing.
Thank you so much for having me.
Okay. And if you want to be interviewed by Lady Talk, please don't hesitate to reach out at shinewithcourage.org, or you can email me at shinewithcourage@gmail.com. Thank you.